Swastiastu. We are from SGD B10. Today we would like to present our student project with the title Growth Hormone Therapy. This is our group members and my name is Putu Bintang Kirana with three last name numbers are 033. The next part will be explained by my friend.
Let me introduce myself first. My name is Zafira Kumala Dewi with last three digit of student number is 122. Now I will start the explanation about chapter 1, introduction and background information. First, growth hormone therapy is used to treat growth hormone deficiency in adult and children by stimulating body growth and reproduction cells which are normally produced in the pituitary gland. GH therapy itself can be administered subcutaneously in elderly, starting with low dose with the principle of prioritizing benefits and minimizing side effects. However, the doses are different depending on body weight and the disease, and some people with contraindication could not be given the therapy. Growth hormone therapy has a beneficial effects on bone structure, body composition, cardiovascular risk factor, and health-related quality of life. It is safe and effective treatment for growth hormone deficiency in adult and short-stature children, but giving this therapy for a long time can trigger some side effects, and the side effects must be handled properly. Based on the description above, this need to be discussed further to get a good understanding of growth hormone therapy. Thus, the writer considered writing a literature review with the title Growth Hormone Therapy. That's all from me. Thank you.
First, let me introduce myself. My name is Febryano Adi Prawira with the last digit number of 156. Now I'm going to explain about the problem foundation of the student project. First, what is the definition of growth hormone therapy? What are the types of growth hormone therapy? What are the mechanism and procedure of growth hormone therapy? What are the indications and contraindications of growth hormone therapy? What are the benefits of growth hormone therapy? And what are the side effects of growth hormone therapy and how to manage those side effects? Next, what the objective? The general objective of the project is to gain an understanding about growth hormone therapy, while the specific objective is based on the problem foundation. Next, about the benefits. First one is to get an understanding about growth hormone therapy from various credible sources, to review literature about growth hormone therapy to see if there is anything that needs to be further improved or studied further, and to help undergraduate students learn more about the clinical knowledge required as a medical professional. That's all from me. Thank you.
Next, we will move to Chapter 2, Literature Review. For the first one is definition of growth hormone therapy. But before that, let me introduce myself. My name is Putu Indriati with last digit number 231. Growth hormone, which is also known as somatotropin or human growth hormone, is a peptide hormone that is produced by the pituitary gland in the anterior lobe. It encourages the growth of almost all body tissues, including bone. Growth hormone therapy or injection of growth hormone into the body is the most common treatment for growth hormone deficiency in both children and adults.
Okay, my name is Bitaqia Agustia with trilogy number 105. Synthetic growth hormone has an identical structure to natural human growth hormone. There are 5 types of growth hormone currently marketed, including gonadotropin, hemotrope, zeaxanthin, simplex, and somectin. All types are synthesized using gene technology. There was no difference in growth response between the 5 types. However, there are differences in teaching, support services, and injection systems. Okay, this is all from me. Next will be explained by my partner. Thank you.
Hello, my name is Indyarwan Ananta Seno with last 3-digit name 091. So the mechanism of growth hormone. The human growth hormone has 2 main mechanisms of action. There are direct action and indirect action. The direct action affect the human body through this mechanism where the hormone would bind itself to the target cells to stimulate response. And the indirect action, it affects the mechanism of insulin-like growth factor 1. So when there's an elevation of human growth hormone binding with the target cell, this will induce the increase of gene transcription and metabolism to produce insulin-like growth hormone factor 1 into the circulation. This hormone has an effect on peripheral tissues, mainly on its growth and metabolism.
My name is Gede and Renathan with student number 193, and I will explain about the procedure of growth hormone therapy. The objective of the treatment is to maximize benefit and minimize the side effects. It is recommended that the therapy should start with low dose, where at start, the daily dose is given via subcutaneous injection at bedtime, where young men takes 0.2 milligrams, young women 0.3 milligrams, and older individuals 0.1 milligrams. The dosage should be increased gradually on the basis of clinical and biochemical response, such as BP, BMI, weight, quality of life, or side effects, and also the IGF-1.
Hello, thank you for the opportunity. My name is Putu Bintang Kirana with three last digit names numbers R033. I will explaining regarding the indication of growth hormone therapy. So the use of growth hormone therapy is used in pediatric and adult according to the table. For pediatric, the indication are those with short stature homeobox containing genes or SOCs, idiopathic short stature, Turner syndrome, Noonan syndrome, Prader-Willi syndrome, chronic kidney disease, and failure to catch up growth because born with small for gestational age or SGA. For the adults, the indication are those with HIV/AIDS, especially with wasting syndrome, and those with short bowel syndrome. That's all from me. The next part will be explained by my friend. Thank you.
Hello, doctors and friends. My name is Novea Indratmo, and the last three digits of my student number is 119. Now I'm going to explain about the contraindications of growth hormone therapy. The first and most important contraindication is the presence of active malignancy. This is because, theoretically, inducing growth hormone therapy may increase the growth of active malignancy. That is why any pre-existing tumor must be treated immediately first before inducing growth hormone therapy. There must be extra attention paid to pituitary tumors because one of the early symptoms of pituitary tumor is growth hormone deficiency. That's why it can be very dangerous if we treat it with growth hormone therapy. Other contraindications are hypersensitivity to somatropin, growth therapy for pediatric patients with closed epiphysis, and then proliferative diabetic retinopathy, and then Prader-Willi syndrome with obesity or deterioration of respiratory system. And the last one is pre-existing acute critical illness like heart or abdominal surgery, multiple trauma, and also acute respiratory failure.
My name is Nandhita Naaz with the last digit of student number 189, and now I will explain about the benefits of growth hormone therapy. Growth hormone therapy has beneficial effects on bone structure, body composition, cardiovascular risk factors, and health-related quality of life. And here are the benefits of growth hormone therapy. The first one is increase in bone mineral density, or BMD, reduction in fat mass, increase in muscle strength, improvement in quality of life, reduction in the incidence rate of myocardial infarction, and improvement in skin quality.
Good morning, my name is Nyoman Medhira with the last digit of that number is 070. Now I will explain about the side effects. The side effects of growth hormone therapy are highly dose dependent and are often mild and transient. Therefore, it is recommended to start with a low dose of growth hormone and increase it gradually. Edema, muscular pains, joint stiffness and discomfort, paresthesia, carpal tunnel syndrome, and headache are common side effects brought on by fluid retention and usually appear during initiation. Numerous studies have shown that growth hormone treatment can improve quality of life, physical fitness, and body composition. Growth hormone treatment also increases the risk of cardiovascular disease and cancer. This concern arises because of the increased incidence of this condition in acromegaly patients who have long-term high growth hormone concentration, but there is currently no evidence that growth hormone therapy affects the risk of cancer or cardiovascular disease. So that's all from me. Thank you.
Hello, my name is Gede Basudewa Wikanjaya with last three digits of my student number is 139. So from the previous explanation, we know that the administration of growth hormone will cause some side effects, but fortunately, these side effects could be controlled. There are some ways to manage them. The first line, of course, to adjust the dose of growth hormone that we administer to the patient. These are for mild side effects such as swelling in the arms and legs or joint or muscle pain, but for the severe side effects such as acromegaly or carpal tunnel syndrome, we could administer other medicines such as dopamine agonist or growth hormone antagonist.
Okay, my name is Gusti Agung Librawan Darmalaksana with three last digit of student number R029. From all the discussion above, we can conclude that growth hormone therapy is a therapy that injects growth hormone into the body in children or adults who have growth hormone deficiency. Growth hormone can work directly or indirectly, where administration starts from a low dose then increase progressively. The side effect of growth hormone therapy appear due to fluid retention and occur during initiation, such as edema, muscle pain, joint stiffness and discomfort, paresthesia, carpal tunnel syndrome, and headache. And that's all our presentation about growth hormone therapy, and thank you.